Welcome to Shape It, where we provide you with latest information and tips on how to achieve your health and fitness goals. So, join us on this journey towards optimal health and fitness, and let's make our health a top priority together. Today is about intermittent fasting. Intermittent fasting is a dietary pattern that involves alternating cycles of fasting and eating. It is not a diet but rather an eating pattern that focuses more on when to eat rather than what to eat. There are different types of intermittent fasting, which is solely depending on fasting periods, timing and how often you would do it. The benefits of intermittent fasting includes but not limited to weight loss, improved blood sugar control, reduced inflammation, and improved heart health. Some studies have also shown that intermittent fasting, may help improve brain function, prevent cancer, renewal of cells and extend lifespan. People who want to lose weight and improve their health have become more and more interested in intermittent fasting in recent years. Intermittent fasting has many advantages, one of which is that it can lessen insulin resistance, a risk factor for type 2 diabetes. Fasting forces your body to burn stored glucose as fuel, which can gradually increase your sensitivity to insulin. Inflammation, a major contributor to many chronic diseases like heart disease, cancer, and Alzheimer's disease, may be reduced by intermittent fasting as well. Intermittent fasting has been shown in some studies to help lower inflammation markers like C-reactive protein, CRP, and interleukin-6, IL-6. Intermittent fasting may help to protect against neurodegenerative diseases and enhance brain function in addition to these advantages. A protein known as brain-derived neurotrophic factor, BDNF, which is produced by your body when you fast, aids in promoting the development of new brain cells and wards off cognitive decline. Although intermittent fasting may have these advantages, it is not right for everyone. People with certain medical conditions, such as diabetes or eating disorders, should refrain from fasting or seek advice from a healthcare provider before beginning it. Fasting should also be avoided by women who are pregnant or nursing because it may harm the fetus or reduce the amount of milk produced. Some popular types of intermittent fasting include time-restricted feeding. This involves eating all your meals within a specific time window each day, typically 8 to 10 hours. For example, you may choose to eat between 10 a.m. and 6 p.m., and then fast for the remaining 14 to 16 hours. Alternate day fasting. This involves alternating between a day of fasting and a day of normal eating. On fasting days, you may eat only a small amount of food, such as 500 to 600 calories, or no food at all. 5 to 2 fasting. This involves eating normally for 5 days of the week and restricting calories to 500 to 600 for the other 2 days. Periodic fasting. This involves longer periods of fasting, such as 24-hour fasts once or twice a week. If you are interested in trying intermittent fasting, it is important to start slowly and gradually increase the length of your fasting periods over time. You may also want to experiment with different types of fasting to find the one that works best for you. It is also important to listen to your body and stop fasting if you experience any adverse effects, such as dizziness or weakness. If you are interested in starting intermittent fasting, it is important to consult with a healthcare professional first, especially if you have any health conditions or are taking medication. It's also important to ensure that you are getting enough nutrients during your eating window, and to stay hydrated all throughout the day. Thanks for watching. Please like and subscribe.